Well, welcome. My name is Denise Harlow. I'm the CEO of the National Community Action Partnership, and we are thrilled to have you on today's webinar to talk about a new report, a national imperative joining forces to strengthen human services in America. I know today's webinar is focused on the Community Action Network, and I know we have a few folks from outside our network on the call today, but most of the folks on today are from Community Action local agencies, state CSBG offices, and our state associations and national partners. So thank you so much for being on today. We had a great response to this webinar, and I hope that you will follow up after today's webinar with additional questions, comments, that you download the report, take a good look at it, and we continue this dialogue. So today we're going to be joined by several presenters. I'm joined in person by Tracy Waring-Evans from APHSA, the American Public Human Services Association, works with all the public entities across the country. Tracy was with us last year at our August convention, working with our public community action agencies. We're also joined by Susan Dreyfus, the President and CEO of the National Alliance for Strong Families and Communities. She is based out of Wisconsin, so she's not with us here in person, but she is on the line here today via web meeting. And her other staff, she does have staff based here in DC as well, and they are also a national network of organizations of human service entities across this country. And I believe some community action agencies are also members of the Alliance. So we're really excited to have this team on today's call, that we can actually bring the folks who commissioned this report, who have really been in charge of the kickoff of this report and its findings, directly to you as community action agencies so we can create a dialogue here today. So just to kind of put some talking points in the back of your minds as you listen to Tracy and Susan's presentation here today, I think you're going to find that a lot of the content that they share with you will resonate. Because the work community action has been over the last few years, we are primed and ready, I think, to take the recommendations from this report, to take the 5 North Stars, as you'll hear about, and find ways to interweave our work and to take the Community Action Network and interweave it with the Alliance and APHSA's work going forward in this space. Certainly, Community Action is a critical partner in what they're calling the human services ecosystem. And one of the comments I really liked in the report as I reread it in prepping for today was that all human service ecosystems are local. And what makes Community Action, I think, so strong in this space is because community services, block grant, and community action, we're connected nationally. We have a state presence, but it's all about local control, local decisions based on local needs and resources. So this concept for me really resonates with community action. The second piece is, and I know all of you have been living with us over the last 5 years, is we've modernized our performance management and our performance measurement system. So when you hear the North Stars talk about focus on outcomes, service integration, data integration and interoperability, financial standards and financial accountability, I think community action has truly made strides down this path that kind of help us put at the forefront of this curve that I hope will build and help amplify the work that we're going to talk about here today. Certainly our focus on outcomes. We now have our theory of change. We are focused on 3 national goals that are truly outcome-focused for families and communities nationwide. We see ourselves as local innovators. We truly believe that CSBG, the Community Services Block Grant, is that innovation fund in some ways that we have at local agencies. It's our social capital to try out new programs, to try new methodologies, to do community-level change rather than individual family work. It really varies across the country. So again, a lot of what grounds us as community action resonates well in this report. One of the pieces you'll hear in the North Stars is the focus on increased financial awareness about where nonprofit and other community-based organizations fit in terms of financial viability. And we know that we all struggle with whether it's advances coming down, whether or not we're floating dollars out to state and federal governments or local funders around running programs, waiting to be reimbursed. All of that's going to resonate with folks on the call today. And certainly the data collection and the integration of data with our new national performance indicators focus on family and now community level change indicators, that we've created a system by which we're going to be able to report national data on community level work. I think it's really exciting when we take this report into consideration. And I know you've seen this, and I know you'll love it. Our national theory of change, it's got a lot of moving parts, But again, when I'm reading this report, overlaying it with our theory of change, we talk about a national group of organizations that partner, that we believe was one of our core principles, that partnership is critical. You're going to hear that in the North Stars. We talk about we're going to be accountable and we're going to be well-functioning with infrastructure within our organizations. You're going to hear that in the North Stars. When you see our 3 national goals, focus on families and individuals and community change, you're going to hear that in the North Stars. So I can't emphasize enough that I see so much overlay between our organizations and the work coming out of this report. We are a national network. This slide is no stranger to any of you, right? We served 15 million people last year. Our footprint in that human services space is significant. And I'm not sure it's in the slides, but one of the graphics in the report talk about the human services ecosystem, and it talks about probably 15 different kind of domains of services. Community Action has a footprint in all of them. We are truly married, I think, in this work. So as we talk about human services transformation with Susan and Tracy today, some things to keep in mind. Public and private community action agencies, we have a role to play in this space. Our state CSBG offices have a true role to play in this space as well. The national partners, our state associations, the entire network has a role to play. And again, I'm just so excited when I read this report. I was excited when Tracy and Susan said, yes, we will definitely be engaged with you on this effort to have us be here today on this conversation. So I'm going to transfer the ball over to Susan, and while I do that, keep in mind in the Q&A and chat windows, we want you to put your questions, your concerns, things you'd like us to follow up on, and we'll make sure to kind of circle back periodically through today's presentation to answer your questions, and if we don't get to everything today, we will certainly follow up with folks who are on today. So with Susan, I am going to go ahead and unmute you. So you are unmuted, and I'm going to transfer the call to you, and you're just going to tell me next slide. I'm sorry. So you can go ahead and start talking, and we'll get the ball rolling from there.
Thanks so much, Denise. I'm sitting here thinking about my husband wishes he could have that mute button. Sometimes have the mute button to mute me. Anyway, after 40 years of marriage, I guess that would be his prerogative. Listen, Denise, thank you so very much for this. Tracy and I were just absolutely delighted to get your invitation. Your theory of change aligns beautifully to APHSA's as well as to the alliances, and I agree with you, networks are the currency of the day, and we're clearly going to be stronger together. So it's awesome that we had this opportunity to come together. I want to just do a shout out to the community action agencies that are out there, those that are administering CSBG. My background started with you all. I was chief of staff to a county executive in Waukesha County and had responsibility for CSBG, and it was through there that I really got very oriented to the importance of affordable housing and how to move forward on that. When I was the administrator for children and families for the state of Wisconsin, I worked closely with community actions because CSBG was under my portfolio of funding sources, and you taught me so much. You taught me how community action is close to the ground, how community action is constantly innovating. Whenever there were issues we were facing, I could always count on a community action agency to come and share with me what those solutions would be. Dick Schlim, who I worked with back then, I still remember to this day. But you also honored me with the first public sector leadership award that CSBG, the community actions had given out in Wisconsin, and that was just a true honor. So I just want to thank you for the work you do. You're about solutions, but you also always remember, whether it's for the child, the family, the community, the state, or the nation, you always remember that paramount responsibility to advocacy and being voice for those who oftentimes don't have that voice. So I just wanted to make that specific personal shout out to you. You're near and dear to my heart. This next slide, if you could go to that, Denise. I want to kick this off with this groundbreaking cross-sector partnership. Tracy Waring-Evans serves on the board of directors of the Alliance. I serve on the APHSA board. We have been longtime partners because most of my career has been in the public sector, as has Tracy's. But one of the things that was quite clear to me is that the one thing that can keep me up at night, if I'm truly honest with people, that things can indeed keep us all up at night, it was that as I was traveling the country in my role now as CEO of the Alliance, after having spent most of my career in the public sector, I really do believe one of the last doors to slam on the Great Recession is a deep financial structural problem that has been created in America's community-based organizations It is a complex challenge. It's not created or fixed by one singular action. But one of the things that I also knew is that the sector had to look at itself, but we also had to have our government partners and philanthropy coming right along with us. It's why I went to Tracy and want to thank her so much, because when I went and presented this idea to Tracy, she leaned in immediately and said, yes, APHSA will partner with the Alliance on putting out this very important report. I knew we had to get underneath not only the transformative potential of this human services system, but we also had to be very honest with what are the problems, the challenges, the root causes, and the solutions. And that is why we went about doing this report. If you want to go to the next slide, we put together a national advisory council of leaders from across the country. I'm not going to go into them, but you'll see they came from all walks of life in terms of the kinds of parts of the system that we thought they represented, from healthcare to insurers to the U.S. Chamber of Commerce to academia, et cetera. That was a very important piece because they helped us be a sounding board as we went through this process, as well as what you'll hear about the rigor that we put forward in coming up with the data and the insights that we received. Next slide. So we went to Ballmer Group and Kresge. They were our lead funders, but you'll see then the other folks that came along and funded this project as well. What was very, very important here, though, is that Tracy and I knew that this report had to be disruptive, that if this report was created by the sector for the sector, it was likely going to sit on a shelf, and people would say, well, we've seen that before. And so I just have to check here why I have lost, there you go. So we went about and went to Oliver Wyman. They're a global business management company under Marsh McClellan, and we went to Sea Change Capital Partners out of New York City. These were both very important entities in New York with the collapse of FEG, so everyone might have remembered the large Jewish organization that no one saw coming, that all of a sudden was going bankrupt, and they did a lot of work in that regard. So we went to them, and I just have to give a shout out to Oliver Wyman. They put over $1 million of in-kind corporate support into this project because they truly believed in this from a corporate social responsibility standpoint. We could not have done it without them. So just a good shout out to them. Next slide. So why this report now? I just want to reiterate, as people know, is that improving the financial stability, the sustainability, and the impact of the nonprofit social services sector is paramount. And we know that we play a vital role, but like as I said before, with what we have in terms of growing demand for our services, the increasing complexity that we are up against in our operating environment, the uncertainty that we're facing as more and more is moving to managed care and the timing and amounts of available funding, and what's happening on the federal front is just creating increasing uncertainty in our funding environment, but also just the rapidly changing business environment that is in front of us with both incredible opportunities as well as challenges that are requiring us to have capacities that we today are not consistently able to hold within our organization for the future, and we'll go into more detail on that. The next slide. So the report was a very rigorous review. We worked for about 9 months on this study from last spring through last December. We crunched a ton of financial information about human services community-based organizations. We believe that this could be one of the largest crunching of 990 data that's ever been done. We looked at 45,000 unique community-based organizations over a 3-year period of time. So we looked at over 200,000 tax filings. We surveyed and directly spoke with over 200 leaders in the human services ecosystem, public sector, philanthropy, key audiences that we felt would have a point of view about this topic. And that was very important to this work. We had deep interviews with academics who focus in on this part of our field and sector. There were a lot of themes and findings that surfaced during the study that will be familiar to many of you. And one of the things I have to ask you is that you're going to hear these things and you're going, well, Susan, heard these things before. To that, Tracy and I say exactly. We've heard all these things before, and we're still confronted with them, and that can't be good enough. That's why we did the disruption of the partnership with public sector and our sector. That's why we went to an entity like Oliver Wyman to do this work. We've been talking about these things for a very long time, and it's time for them to change. So the financial analysis we did for this study was deep and comprehensive. There are a lot of opinions and perspectives that are out there, and we have tried to develop a very deep fact base for what sits underneath this report. The other thing that's important is this study brought together different groups who are often on opposite sides of the aisle. And in this time of division in our nation, it is really important that we demonstrate that we can come together, have differences of opinion, but always putting children, families, and communities first, we can get to the right answer together. And so that is one of the reasons why we had people that were not just going to sing Kumbaya with us, but people that would give us a real diversity of opinion and perspective and differing opinion and perspective to this work. And it helped us to really challenge ourselves in our thinking and the kinds of recommendations we put forward. The next slide. So what I want to do here is set the context for the major findings. And there are some things here that I will tell you as someone that's been working in this work a long time, were surprising to me. First of all, in this slide, you see all of the ways in which the community-based organizations receive their funding on the left-hand side and on the bottom of the chart that you see. But what might surprise you is that this totals what we estimate to be $200 billion. And that is simply the contribution into the human services ecosystem of community-based organizations. That $200 billion, to put it in perspective, is roughly the size of the American airline industry, which was really quite surprising to us. The other thing that's important to keep in mind is that oftentimes what people think about in terms of community-based organizations, they think about small, volunteer-driven organizations, and there's certainly a lot of those. There are 218,000 human service community-based organizations. 80% of them have budgets of less than $500,000. What was a surprise to us was that 3% of human service CPOs, just 3% of them, account for 50% of that $200 billion. Just 3% count for $200 billion of that, and that 3% have budgets in excess of $10 million. Everyone else is underneath that amount. And I think that was a surprise to everyone involved in the study, and something that we knew we had to lean into in our recommendations as well. We also found a very simplistic view of community-based organizations as charities, and it reinforces the belief that CBOs are mostly funded by donations. But as you see from this chart, you'll see that the vast majority of our funding is coming from government and coming from government sources, and it's something that people don't well understand, the increasing use of community-based organizations by government. But size isn't the only measure of importance. What we also did in this report is we want to think about how important these services are to the individuals and communities who receive them. And so on the right side of the chart, through our analysis, 1 in 5 Americans are receiving critical human services from community-based organizations each year. And you can go on down to the rest of them that are there, but just one of those things to keep in mind is that 700,000 kids pass through the foster care system each year. And with our country's increased emphasis on trauma and understanding toxic stress and the brain science, we know there is a huge correlation to the well-being of America's families and the well-being of their children and their ability to achieve their full potential throughout their lifetime, making the role of community-based organizations not just vital, but we now have clear science that sits underneath the imperative of our sector. The next slide. So we looked at this and we said, okay, there's an opportunity for CBOs, and you're just getting a snippet of the report. The full report is available on our website, as well as the slide deck, executive summary, podcast, etc., talking points. But here was a slide that was also very important that I really appreciated Oliver Wyman leaning into, and I thought it was interesting how they did it on their own. They said, wait a minute, we're trying to have a vital economy in our country. For America to be strong and vital, human capital is critical to the economic vitality of our nation, and there is a much larger role that these community-based organizations play in terms of the economy of the United States, not just in terms of what we contribute through ROI with economic contribution through the expenditure of $200 billion in economies all over the country, but we also know that the vital role that we play in reducing future healthcare costs and reducing future criminal justice costs were two of the areas that we zeroed in on in the report. I'm going to focus my comments today more on the area of healthcare, but what we did here is wanted to make it clear to people, this isn't just about fixing a problem, this is about leaning into an amazing opportunity to realize the fullest potential of America's human services ecosystem, that community-based organizations are a vital component of that ecosystem. They are finding themselves in a state of continued weakening from a financial perspective, and everyone needs to care about that. If we're our fullest and best self, so can that ecosystem be. So on this next slide, we go deep into health. I will tell you, as a former Medicaid director in Washington State, all I talked to the governor about was the 5% of the population that drove 50% of the cost. And I kept telling her, Governor, I can do everything you want me to do to move everything to managed care. I can figure out how to buy better, smarter, faster, cheaper on drugs. I can figure out which tests we're going to pay for and which ones we won't because of the scientific proof behind them, et cetera, et cetera. I can do all these technical things. But this neurobiopsychosocial intersection of health will determine our ability to not just bend the cost curve, but truly move at a population health level. So this was a big area that we went deep into this report to demonstrate the value of this human services ecosystem. The data on this slide comes from the University of Wisconsin Population Health Institute that studied the determinants of population health. Again, everyone on this call certainly knows this, but just to remind everyone, a very small percentage of our health comes from what happens in that doctor's offices or with our primary care experience. The rest are these socio-environmental factors and economic factors that are the real contributors to your health and my health. And we also know that through that lens, we can't have this conversation without looking at inequities and disparities and racism. They are all alive and well in this slide. The next most important set of factors, though, is behavioral, and we obviously looked at that as well. And reminding everyone, integration of primary care and mental health is not enough. Not everyone has a diagnosed mental illness, but yet behaviors we know and helping people to change behaviors is critical. And no one is better at that than we are as a field and as a sector. So it's not surprising then that what we also found is that in states that were spending more money on health care, this is a Yale study from Elizabeth Bradley, Yale School of Public Health, that studied variation in health outcomes and the role of spending on social services, public health, and health care. What we've also found is that when states are spending more on human services, they are actually within a 2 to 3 year period of time seeing reductions in health care costs. We know that in every other industrialized country in the world that has better health outcomes than we do as a nation and spending a lot less money than we are, for every $1 they're spending on health care, they're spending $2 on human services. In America, for every $1 we're spending on health care, we are spending a measly 50 cents on human services. That simply is going to thwart our country's ability to be successful in bending the cost curve and improving population level health metrics. Next slide. So we made the case, we believe, in the report, much more detail in the full report. We feel we made the case for the transformative potential of the human services ecosystem and why it matters to a vibrant economy and why it matters to the building of the greatest asset our country has, and that's our people. But we also had to look at the reality. And so through this 990 review, it got pretty sobering at times, I have to admit. It was affirming what I see as I travel around the country with community-based organizations from large and small. If you ask me, one of the things that really surprised me in this is that what I was seeing anecdotally was true in the data. It didn't matter a lot by size in terms of the health of community-based organizations. So first of all, 1 in 8 among us, human service community-based organizations, are technically insolvent. Greater than 40% of them lack liquidity to meet their short-term obligations. Nearly half had a negative operating margin for over 3 years. 30% have reserves covering less than a month of expenses. It didn't matter, obviously it was worse for the smaller organizations, but it didn't vary enough for us to say that it was radically different between those small organizations under $1 million and that 3% of that 210,000 that were over $10 million that I referred to earlier. We thought that was a very important finding, but we also found that there were a lot of causes underneath this in terms of why do these conditions exist. What we found, because again, I want to be really clear, we went into this report with an independence and a joining of hands to say we own this problem together, we are each responsible for it, and no one of us alone can solve it. This is about partnership, not blame and shame, and there was no finger pointing about this report. It was what's the causes, what are the solutions, and what do we each need to do. Well, we found problems in community-based organizations. We found a lack of financial reporting and risk management capabilities. One common refrain that we heard a lot from CBOs that have faced financial crises is they were blown away by them. They were shocked that they occurred. They didn't see them coming. All of a sudden, they weren't meeting payroll, and they were not sure why that was. One of the things that Oliver Wyman said, and these aren't my words, these are their words, that it appeared to them that some of the best minds in communities are sitting on boards of directors, but they're not using those best minds in the boardroom as it relates to doing necessary testing of risk within organizations. There is a lack of commitment to building reserves and management infrastructure, and this is where our sector's heart comes in. We don't want to say no to anybody. We keep taking contracts that are funding us for less than what we know it costs us to deliver good results. We keep trying and trying and trying to say, we'll backfill that with other dollars. We'll keep doing it. Well, at some point, it comes home to roost. And what we're finding here is that this is that last sort of slam on the Great Recession. I think it was being masked because revenues were better back then. But we're not going back to the way we were in 2008. A new normal is studying itself. And one of the things that Oliver Wyman said is that organizations are going to have to start saying no to the chronic underfunding of contracts, or promising that they can deliver results that are not possible with the resources that are being allocated to that purpose. The other thing they found was government agency contracting practices have to change, and I'm sure Tracy will talk about that more with the North Stars. But instead of being cost plus, as in every other industry in the country, our contracts are always cost minus. That we're not being reimbursed for the full cost of what we're being asked to provide, and we've got to be clear that we cannot provide what it is that we must provide and have the capacities we need without that. The other thing that they really commented on was around the administrative and overhead, that what is being asked of us in delivering of services is getting bucketed into an artificially controlled administrative and overhead services pot, and those things that we're being asked to do are critical to program, and they shouldn't be considered at administration and overhead. They should be considered critical to programmatic results that we're achieving. The next slide. So what were some of those additional roadblocks and challenges? One of the things, and I'm sure Tracy will comment on that, and I'm going to go to the third one over, that I think was really important because we own this. We at the Alliance know that we own this. If someone asks me what's the one thing I'm trying to do during my tenure at the Alliance, it is to change the sector's narrative, how the sector sees itself and how it is seen by others, that we're not just these providers of programs and services, these charitable organizations just getting by. And that is a mistaken belief that came out loud and clear to Oliver Wyman in the surveying and in the focus groups and the interviews that they conducted, is that there really is a failed narrative about the human services ecosystem and about the imperative of our sector in this work and the role that we play. The other thing that we recognized here is just the inability for our sector to have the necessary technology and talent that is critically important, and something, again, we'll talk about more as we go into these North Stars and some of the strategies that we want to deploy for working in this area. So I think I went through a lot of these. The last one that really came up was regulation. And I would say to you, Denise, if there's a place that we could come together, is I really think this is a tough issue to really get specific on regulations that are outdated, that are no longer viable, are overly costly to implement. But we do have examples of where people have been leaning into this regulatory relief, but we know we've got to do it, but getting there is not going to be simple. It's more complex than that to really understand where regulations actually come from, whether it's local, state, or federal, and if it's just an interpretation issue or the actual regulation itself that's flawed. But an area that really came up loud and clear. So with that, I'll turn it over to Tracy to bring us home, and look forward to any questions that folks have, and I just hope in the end you'll join us as absolute partners in moving this report and the findings and the recommendations forward. Thank you.
Well, thank you so much, Susan, and I'll let folks know there was one comment that came through the chat window, and I believe it said, quote, preach it, sister. So,
amen. Yes, I'm with you.
So Tracy, we'll turn it over to you. So I have to follow the preacher, or the preacher's daughter. Thank you, Denise, and thank you, Susan, for setting up the report so well and the findings of the report. I'm really pleased to be here. I won't belabor the comments about the localism, but just to reinforce, I think, Denise's point about where local action is, where human services really connects with people in ways that are going to have the impacts we desire. It sits in your networks. It sits in what you do every day. And I love the alignment with your theory of change. It's like these are the things that give you hope about the convergence around the country. And so thank you for all of you who are on the call today that are leaning in your own communities. And I'm here to share a little bit about what came out of the report. So we have these findings, right, some which sober us up a little bit and some which we say, well, how do we then lean even more in together? And so we organized recommendations around 5 North Stars. You can go to the next slide. And I'm just going to highlight these in a brief way and try to draw out some of the examples, and I would really encourage you to go deeper into this portion of the report if you've not read it fully, because this is where it really gives us some opportunities to create, I think, additional impact together. So again, just to emphasize, these 5 North Stars, if you will, are really about a shared journey together. They are designed to give CBOs, the public sector, government agencies, really at all levels of government, and philanthropy, and we would probably add to that, employers and others in our community, ways to see their way of supporting the road ahead. That this is, Susan said so well, not a blame game, but really one of saying, okay, here's where we are today, we understand our context. Now, how do we create a space for us to move ahead? So, first one, commitment to outcomes. This is not a surprise to anyone. It's in your own priorities and theory of change. And I would say more than anything else, as we worked with Oliver Weinman, as we heard from our National Advisory Committee, as we initially rolled this report out with a set of community folks that came together to really help us think even more about it, what came to the top consistently was the need to orient our communities around what we want for those communities, right? So very asking the questions about what are we doing in our own community that is allowing everyone to thrive, live well, and be healthy in that community. And so around the North Star commitment to outcomes, the report talks really about ensuring that CBOs even have the baseline and the capability to track to outcomes, right? And that comes in a couple of these North Star recommendations. But how do we invest in the capacities to really understand what it is we're sitting on and how we have those impacts? How do we incentivize programs that are going to achieve good outcomes? And certainly there are places around the country that have really leaned in as to how to incentivize and create processes both in contracting and procurement and in modernizing our reporting requirements so that we're not just capturing outputs, but that we're really getting at how communities are doing and incentivizing and, importantly, rewarding organizations for achieving those kind of impacts. And then I think an increasing effort here you'll see around developing standardized metrics. So how do we use networks and associations, universities, colleges, places where data may already sit, but we're not utilizing it. How can we bring those together and create more standardized processes to get to those outcomes? So that's really centered in that first one there on commitment to outcomes. In North Star number 2, the capacity for innovation. Again, in the dynamic world and in the pace of change that we have today, the need to create space for constantly innovating is not new to us. However, it isn't necessarily systemically built into the way we carry out our work. And so there's a real call here in this North Star to create that place where you have a safe space to test things, where CBOs are given the opportunity and the capacity to innovate. I've often said to Susan, as someone who works in the public sector, I know that my community-based organizations who are on the ground and closer and connected to families often have the greater ability to innovate than I do in the public sector, but if I haven't given them the tools to really draw on that innovation and lift it up, it can be a struggle, even though you all are so much closer to the ability to do that. And we have to give you the space really to fail forward, right? So some things we will test and they won't work, and we need to be able to create learning cycles and build that into the way that we all see the world, as opposed to disincentivize it or create any sort of penalty that comes from trying to test new things in a learning cycle. We have to be able to enable the sharing of program data, right? So again, kind of coming back to how do we get to outcomes? We have to be in a place where we're optimizing data, where we understand data usage, where we're building the capacity of our own workforce to use the information and data that they have in front of them. And then we're sharing ecosystems and data across the board. And I think there's been a great effort, and I will say this from a public sector side, to spend more time thinking about how you actually optimize and integrate and create interoperable systems. I think really shame on us, and I'll say this as a public sector leader, for not always thinking of how human services are delivered across the country, the ways in which we rely on community-based organizations, and that data doesn't exist in only the public sector or only one place. It really is something that has to come from everyone who's touching and working with the family, including the family itself. So thinking about data in a much more holistic way, and creating incentives and ways for us to share across the board, and creating processes that are also going to increase more of that innovation, thinking about other players who might be at the table. So government funding for innovation in the way that they often do it in startups right now, right? So technology startups, you'll have states who will invest in incubators or accelerators. Why don't we have that in the human services space? Why don't we create a space where those of you who sit in these action networks could really build and partner perhaps with social entrepreneurs who really want to give to their communities in ways that would really lift up and create that space of innovation. In North Star number 3, around an operating model 2.0, this really is about partnership. This is, I think, the intent when this really came through in speaking with our National Advisory Council about changing the intent of the ecosystem actors, right? So leveraging our assets in ways that are much fuller, that require us to be partnering together in ways that foster that innovation and, quite frankly, reduce the friction that we spend a lot of energy on right now that isn't the kind of energy that gets us to the impact and outcomes we want for our communities. So to do so, we have to embrace partnership in a different way. We have to think about contracting and procurement in a different way. This is the place where public sector has to lean in with community-based organizations and treat community-based organizations as partner in this effort. It's a long-term road, not a short-term one. Susan mentioned earlier that we have a tendency to design our contracting in short-term cost-benefit analysis without really thinking about what is the long-term capacity of investment for the community and the kinds of returns that are going to come in on the back end if we are to treat these really in a much longer-term community health rather than a let's just get the low-cost service provider. That takes us coming together. We are institutional pieces, ways of doing business and procurement and otherwise that we have to find our way around and through. So creating more integration opportunities, incentivizing coordination and integration, developing operating models that allow CBOs, for example, to share their own resources, right? So this may not be full mergers, but there may be more backroom and shared capacity pieces that are really helpful. Some states have spent time really looking at prompt payment systems. I hear this, if I probably ask folks on the call, one of the most frustrating things is the payment delay that often comes in the contracting arrangements. I will share with you when those conversations were surfaced with some of the sector leaders from APHSA who are in the state sector. I had leaders who said to me, I really didn't realize, I had no idea that there were delays that people were experiencing. So some of this is even just awareness and making sure that we're having shared conversations together about how to work through that. And I would point your attention to if you're looking at the report, there are some very interesting attributes designed in a model about how to really think about and move from a traditional procurement arrangement to one that is much more of a partnership and relationship approach to procurement. And so, I won't go into detail today around that, but just this is a shift I think we have to really spend some time on. North Star number 4 really calls on all of us to think about financial management policies and practices, and some of this Susan touched on in the findings, right, which is what are the ways in which community-based organizations may have to do some self-reflection and think about how are they really looking at risk in their organizations, how are we engaging in regular scenario and continuity planning, thinking about all the ways in which we might have areas of risk, and have we really walked through them and played scenarios out for the future and thought about ways to mitigate and reduce that risk. This is stuff that takes time and is a commitment, I think, on all of us to say that there is, it can feel like I don't have the time or energy for that, but the risk on the other end of not doing it is much greater. And I think you've spent a lot of time talking about performance management and some of those pieces that really, I think, fit nicely in this work. Paying CBOs for full costs on a timely basis and providing financial support in times of stress. Yes, you just heard a public sector leader say that, right? Just developing a more standard economic model for the full cost of delivering services is a really strong point in this report. Again, it's going to take some time. It's going to take a shared understanding about some of the difficulties in moving through that because of institutional ways we've done the work, but the time is now. We call this the national imperative for a reason, to really bring folks together to find the solutions. We know the solutions are there. I hope, folks, when you read this report, you see how solution-oriented this is, and I'll touch on some of the success stories across the country already in just a moment. But we really need to find ways to get to the other side so that we are not creating unnecessarily time delays and the like for folks to be able to have the financial support they need. And also this idea of creating recovery funds when we have periods of stress. Are there ways to pool resources in communities that community-based organizations can tap into in those times, and how many organizations and families ultimately could we support through tough times if we were to think about it and create those kind of opportunities in partnership with philanthropy and others in our community. And then really finding additional ways to unlock additional capital for use by community-based organizations. This could be through social enterprise, as we mentioned. I think that there are some adjacent markets that, if community-based organizations leaned into, could create a other opportunities for capital and earned income, and finding ways also to develop some standardized metrics for the way in which we actually show the return on investment in communities is another key piece of how do you then create additional resources and unlock those resources for community-based organizations. And finally, we have regulatory modernization. This one is a big one, right? And one that I think for those of us who've been in the field for a long time have been talking about the need to simplify. And I'm always struck by listening to my public sector colleagues talk about the need to simplify and modernize regulations that they're impacted by at the federal level to the state or to the local level, and then I can be in the same room and listen to folks who are leading community-based organizations and hear the same words of how it feels in terms of the way that regulations are carried out and the ways that sometimes we get caught in our compliance, right? Having strong integrity in our systems is incredibly important, and no one would want to minimize that. But if it becomes the only thing we do, as opposed to getting to the outcomes we want, this is one around regulatory modernization. Because we've been talking about it for a while, I think this is where the sector's together. The power of philanthropy, of state and local public sector systems, of community-based organizations who work in the space of health and human services, of us coming together, mapping our regulations together, getting really serious about what is in the way and what isn't, giving ourselves additional language and opportunities that help us direct a narrative that's more productive is really an important piece, I think, of the puzzle here, and one that I think we sit on. And I know both Susan and I really want to lean into this and welcome additional partners to come to the table to make this something not that we're just talking about, that we're actually pushing and getting movement on. With that, I will just, we can move to the next slide here, share just a couple of things about what's already out there. There are several cases in here in the report, more than that are just on the screen here, and I'll just highlight a couple. It was really important as we were going across the country, and Oliver Wyman would be the first to tell you this, that they were struck by the fact that nearly every recommendation that's included in the report has an anchor somewhere in the country of someone who's doing it. And so this is not pie in the sky, we can't achieve these ideas. We have a set of recommendations that we can work towards. And so there are several here, a couple I'll just highlight. The way in which partners like Blue Meridian, so bringing philanthropy together and having folks who really sit with expertise and experience, lived experience about evidence-based programs and efforts that are really working and going big and saying to get those to scale, we have to build capacity across the country, and we have to be willing to take some bigger bets as philanthropy in real innovation if we're ready to scale it. And so those are really exciting, I think, opportunities. The Children's Home Society of Florida and Florida's Community Partnership Schools, I think, is just an incredibly powerful example of university and school districts and community organizations having a very shared outlook to that, to talk about the North Star #1, to an outcome for students, and getting at root causes and bringing resources together to say, are we equipping our kids for school and for learning and for ultimate success, and by bringing those resources together are really moving the needle for kids in Florida. Montgomery County, Maryland, a member of the American Public Human Services Association, brought together resources through one of its community organizations really to say, how do we help our own community-based organizations shore up their financial health and risk reduction, and how could we do that in ways that we know as a public sector organization are ultimately going to support us. And many of you may know that Colorado did some work a few years ago around looking very intently at all of its regulations. This was a statewide effort, and eliminating all sorts of regulatory requirements that were impacting community-based organizations by being very methodical and saying, what do we need? why do we do this, what outcome do we get out of it, and then ultimately freeing up resources and energy for folks to really be able to focus on their work. I skipped Dakota County because I wanted to come back to it and share what I think is one of the most powerful things happening around the country, and Dakota is one of many, many examples. But communities that have said, we get that the work we do is around the social determinants, and I'm going to use Susan's term here. She said it's not the social determinants of health, it's not the social determinants of well-being, it's the social determinants of life. And when you orient your community-based services, whether they're delivered through a government contract to a community-based organization or just the community coming together, what we are seeing, and this is the part about I love about local, is we are seeing the capacity to change the conversation. And it's less about which program or funding stream it's coming from. It's more about, are we incentivizing what we need to the people who are actually doing the work on the ground? Have we created a performance-based contracts that are much more dynamic and impactful, right? Not linear in nature. And that's one of the things we're seeing across the country. Dakota County is one of dozens of communities, I think, where that orientation is changing the conversation. And so it takes us full circle to the first North Star, commitment to outcomes. Sometimes you might say that and you think, well, we all are committed to outcomes, but have we really oriented everything we do in a way around them? And I think that's what we're asking all of you to lean in with us, is to how do we create that so that we have that kind of synergy across the country. And so with that, I think we're going to be at a place where we can invite questions and comments. And I would say to all of you, we are very much hoping that the work of this report, and we thank you, Denise, for giving the opportunity to talk to such a great number of people across the country, is about really leaning in together. So it's, it's one thing to take a report, it's one thing to even read it and say and resonate with it, it's another to take it up and advance it. Do you want to add anything, Susan?
Sure. Thank you so much. Just a couple of things I would ask you all about joining us in partnership here is to own this. You don't have to work through APHSA and the Alliance to own this and bring it to life. We have seminars now, symposia that are going on. Minneapolis had one. We've got one coming up in Michigan. Indianapolis will be doing one in partnership with United Way and the Lilly Foundation. There will be one in Boston this next month. And the Atlanta United Way, the largest United Way in the country, is going to host a symposium on the report coming up this spring. We need more of these. We need more where you and your local communities come together, not just to hear the report, but to move the report to action, and that the attendees are cross-sectorial. The Alliance and APHSA right now are working with social finance. We want to lead on creating a laboratory for contracting and procurement reform, so you're going to start hearing more about that as we take this, move it to a funding stage, and hopefully a rollout of a laboratory around the country to stand up procurement and contracting reform as envisioned in the report. The Alliance 2 weeks ago launched a shared service utility. I would ask any of you that know of community-based organizations that could benefit from shared services, whether that's healthcare, risk, finances, HR. We now have stood up a full back office utility for nonprofit community-based organizations to purchase these services from. The Alliance Conference in October in Denver, the APHSA Summit that will be in May, both will be featuring this report and, again, how to take the recommendations to action with more specificity. The other thing I just want to add is hearings. The other thing I'd say is if you could help us with hearings, county board hearings, state legislative hearings. We're trying to get a hearing on the Hill with House Ways and Means. But any way that you can get this in a hearing at the public sector level is also something that we know is going to be critically important to the movement. That would be it. Any Q&A?
Sounds good. It looks like we have had a few questions come in, so I'm just going to scroll here to a couple of them and put them out for you and Tracy to respond to. A question came in, we on Community Action in the Pacific Northwest, we have about 53 agencies with most having significant technology debt. The cost of our agencies to be current in technology, to have the data collection and reporting systems to provide comparative data. We need help, and I would just add to that, we hear that from across the country. Different funders, both in the same departments of federal government, want different data systems. And how do we tell the story of the Jones family over time? The data integration, we've been struggling with this in a number of different capacities.
Yeah, I think this is one of those challenges that is felt both among the public sector and the community-based organizations together. One piece that I think is really important, and I would encourage folks to think about, is the role of the universities. It's called out in this report. We talk a little bit about where colleges and universities, academic institutions and communities often have the ability to already built into their systems to take data and now we have to work past all of the ability to bring that data to them, right? But there are many ways of doing that. And so one thing is to think about, should we be continuing to build technology within organizations, or are we trying actually to leverage technology and resources that exist in our own communities that maybe have less of an infrastructure build and more of an integrated data that comes back to the organization, but instead of us building separate siloed kind of systems or even connected systems that can often be expensive. And I think this is also a space where there are a lot of organizations in the social entrepreneur space that are trying to come forward and bring different apps, all sorts of things that are changing the way that we're thinking about the work. This is an area where I think in the entire field of human services we sometimes lag, right, in our thinking, and so pushing ourselves to think about ways that might be very different ways of innovating in that space.
Susan, is there anything you'd like to add to that?
Nope. I want to just advance the slide though, and then.
Okay. Well, let's go back to, I'm going to pull up another one of our questions here. Another one can come in. In terms of what are some of the pieces, we have a number of folks on the phone who, whether they sit on their state associations board, so they work with a number of CAPs, they work with a number of private entities, public entities, they are consultants in our network. What are some of the couple of key things you'd want for our network to be doing? You talked about hearings, you talked about trying to engage us in the public policy space, providing symposium and other community forums. Anything you'd want to add to that in terms of list of next steps or things?
Yeah, I would just, because I've worked with you all in the past, don't underestimate your leadership and how you're viewed in your communities. And I think any role that you play as a convener, any role that you can play in helping to facilitate bringing folks together to think about these reports, these findings with local specificity, and then what are specific actions we can take together to move it, I think is just critically important. So the more we come together cross-sector, but these have to be cross-sectorial. It has to be our government partners, it has to be our community-based organizations, and our funders, other funders. And the last thing I'd say is board of directors. I think they're critically important to this. They read like the who's who of their communities. They have political clout and capital, and I think we really underutilize them in what it takes to move change.
Anything you'd want to add to that, Tracy? And I'm glad you raised the concept of boards. Certainly with community action agency boards being tripartite, with a third of the folks sitting around that table are elected officials, that carries water other places. A third from communities that have low income, certainly that resonates and carries communication out to garner additional constituent input into this process. So I think there are a lot of components there. And what elevated for me when you were talking about regulation reform, the partnership's been involved over the last year and a half, 2 years on a rural impact initiative that was engaging 10 rural communities across the country in utilizing a whole family or two-gen approach
to fight poverty. And a key piece of that, and it was an element of federal groups and governments, was that we had a federal barrier busting group. And their intent was purely when you ran into problems that jacked you up, I don't know if that's a technical term, at a local level to get family the services or to integrate services, you had federal partners in the federal government space, you had state government partners figuring out what were the log jams that we could figure out. Was it knowledge? Was it awareness? Was it a regulation that had to be reworked? So I think there's some elements there that we could potentially bring to the table for conversation.
Yeah, that's fantastic.
That's fabulous.
A question came in around the content of health, social determinants, and I love that you're calling it the social determinants of life. In human services, I think we are a little bit amazed that the health community has finally discovered that being homeless, being hungry, and being poor impact health. We've known this for a long time. Are you aware of any sort of, on the medical side of things, in terms of funders, insurance providers, foundations that work in that health space that are particularly amenable to that human services space where we could have a wedge?
So there is I think the answer is yes, and I think from without naming specific providers, I certainly could do that offline with someone if they were interested. But I'll just tell you, I had a call last week with a regional health, what someone would say was a managed care plan. It was a regional health group, and they have completely built their model around social determinants of health and well-being. And they are investing in ways that are about how do we bring the right people to the table. Who do we not know and have we not been working with that is leaning on the ground with people in communities in ways that are going to shape the outcomes we desire, and understanding that that is what's going to get underneath so much of what Susan always says is bending the health cost curve. So what I see increasingly, in fact, I came from a meeting this morning, someone else mentioned public health being at the table. I came from a conversation with a sister organization who works with public health officials. And so there is an increasing, I think, conversation around this orientation that is becoming more than just talk, but actual action. And when I think about the network, and I think about the places that you could have influence, it's really to bring those players together in your community, lifting that up, and moving us from, okay, so now we're all talking about it, how do we actually act on it in a way that is impactful? Susan, you want to add to that at all?
Yeah, working with community-based organizations, I again, because of my work in Washington State with Governor Gregoire being a leader on healthcare reform, I truly believe that healthcare is the biggest disruptive force to impact America's community-based organizations in this decade and into the next. And it's either going to be our greatest moment or it's going to eclipse us. And we've got to choose, and quickly. I think it's moving that fast. So one of the things I always get concerned about in my work with community-based organizations is we're very, very good in talking about our programs and services and what we do. We're not as good at talking about what we achieve and the kinds of capacities and competencies that we have that adapt over beautifully to healthcare. And not just care coordination for high-cost, high-need populations. Very important, don't get me wrong. We need to be doing a whole lot more of it. But we do it through the lens of getting at root causes, of understanding the causal factors that sit underneath that, and then moving on those issues. So you take that together with United Health, where now they've got insurance commissioners that are changing the requirements on how health insurers have to maintain certain reserves and their ability to start spending those reserves. And now United Health is investing in housing development within geographic areas. The world is changing very quickly. If I worry about anything, it's just going to be our ability to keep up with it and thinking that we've got to wait to be invited to a table, that really we've got to get to it. And that's what at the Alliance, I know Tracy's doing the same thing. We're just leaning right into this because I think this could be our sector's greatest moment, but I also worry that if we don't move fast enough, healthcare will basically figure out how to do it without us, and America would lose a whole lot more than just service providers if our sector was further eroded.
Even looking in the last couple of years, the accountable care organizations and some of the funding that's been coming out, and encouraging certainly CAP agencies to be at that table, whether it is that case management role with those high user populations to decrease emergency room admissions. But even that baseline stuff, we're finding healthcare groups recreating their own wheel, and there's really no need to do that. It's more expensive to do in the healthcare space, right? And we are a welcome, across the human services sector, a welcome funnel for that. So I love to hear that you're leaning into that, and we'd love to find a way to lean with you, because for some reason we're not breaking through in enough places where we need to break through. And for community action, we do everything. We have an agency that runs an emergency room. We have family planning clinics. We got health clinics. We got dental clinics. We got it going on. Yeah. So we got to find that way to cross over health and human services in a way that's going to be impactful for the agencies and help stabilize the agencies themselves. Correct.
Right. But we also have a funding challenge. We all want to do these things, but it comes down to money. And we've got to figure out a way with Congress and states for the reinvestment of savings. That as we do create savings with the 5% driving 50% of the cost, the 20% driving 70% of the cost, whatever metrics you want to use, there has to be a reinvestment strategy of those dollars to move what is today a pretty deep-in finance system to be more front-end and preventative. So I worry a little bit that if our sector just sits in the case care management role, that we got to create these savings, but we got to be ready to then move them into the front end and create a more preventative and responsive system. And then lastly, I just say it's that paramount responsibility to advocacy that I think we bear, of really helping people to not forget the vast inequities and what really sits underneath those vast inequities that are more than just about what's happening in healthcare.
Yeah, definitely. Well, I think that hits on all the questions that have kind of come in the door. Okay. Oh, I'm sorry, was there another in the chat window? Sorry, let me pull up one more here. What examples do you have of innovation through data sharing and analysis amongst organizations? There's no doubt that funding to promote better innovation would be most welcome, but are there examples given current, I guess, constructs and resources?
Yeah, there's a really good example, the Enterprise Zone in Minneapolis, where, and I thought it was interesting because the Strategic Partnership 2.0, what Oliver Wyman landed on there was this issue of a modernized supply chain. And they talked about corporations, Costco and others, who have taken a very different approach from just a linear supply chain orientation to this more dynamic, interconnected supply chain, and the fact that these are all critical partners to their ability to be successful in their corporations. Really a movement in that. Well, this is an example of that, and an enterprise, I can't remember the name of it, it's the Enterprise Zone in Minneapolis. I have to get you the name of it, I'm just blanking on it now. But they have created, using supply chain approach, they have created a shared database for folks locally, and they have figured out how to get through the HIPAA and all the confidentiality rules and all the reasons why people say we can't. And they figured out how they could, on a child-by-child basis, have a common view through a common portal to that child and all of the intersecting systems in their lives and staying on top of common data together. So it is happening, and I think, in Washington State, I had the ability to look to a common client identifier across 28 different data sets. And we were, as I was leaving Washington State, opening that up to our community providers to have that same access. So it's happening. We just have to accelerate it.
Yeah, good point. Thank you. Anything you'd want to add to that?
Yeah, I would just say that I think that there are some rich examples, especially in some of the county jurisdictions across the country. Allegheny County, Montgomery County, Maryland have some really strong data sharing agreements in place, and it is just part of the fabric of how they roll, and those are really, I think, good ones to look at.
Fantastic. Great. Well, I'm also conscious of time. We're about 10 after the
hour.
That
last slide, yeah, that last slide, Denise, just tells them how to access the report.
Good point. Yeah, you're right. Alliance1.org, it's right up on their slider. You can download it, that and the executive summary, and your email information if you need to get in touch with us or follow up. You can always email me, and I can certainly forward the questions back out to our colleagues. We hope to have Susan and Tracy with us in Denver at our August convention. So you will have a chance to talk and dialogue, hopefully in person, to hear more. And by that time, I think we'll be able to begin to see what more movement is happening on the report and the recommendations and the North Stars. So
Denise, thank you so much.
Susan. Oh, thank you. We're thrilled.
Thank you.
Thanks, everyone.
Bye-bye.
We'll talk to everyone soon. Take care. Bye-bye.
Bye.